Let's get the medical expert view on what's happening with our pandemic response now. Let's catch up again with Professor Catherine Bennett, who's the Chair of Epidemiology at Deakin University in Victoria. Good to talk to you again, Catherine.
Hi, Chris.
Fascinating to look overseas, because we know what's happening in Australia, but the future is overseas. Singapore has 80% double vaccinations, so higher rates in the UK and elsewhere as well. Yet, of course, there are high levels of infection there. And a lot of the media coverage, I must say, gets very alarmist about that. But the hospitalisation and mortality rates are very encouraging, aren't they?
That's right. I mean, we're seeing in countries with high vaccination rates, when they are tested, and Singapore they've managed to keep this virus under control for so long, they're now seeing, 550 or higher cases a day. But their hospitalisations are still manageable for them, and they have 7 patients currently in ICU. So while they're seeing quite a few hospitalised, they're still not seeing that high number with that very serious illness, which is the bit that really does put the strain on hospitals as well. So they are looking at possibly putting some restrictions in place. They've talked about reducing household, gatherings to 1 a day, but there's many in Australia who haven't had a household gathering for a very long time. So they're still monitoring and managing it. It's still these careful steps out, but at this stage they are still managed to live with those infections in the community.
Yeah, and all communities are a bit different. Singapore's a very centralised place, and a lot of activity happens indoors. Australians do socialise a lot outdoors. But the news there, you'd see it as being encouraging. I mean, obviously you want as many people vaccinated as possible, but if we get to 80% plus, we're going to be looking pretty good, aren't we?
It certainly changes the picture. And we've seen that even in countries where they haven't been able to really control the wave, and it's, the Delta wave has come just as they were relaxing. And we know, very well what happens in places like the UK or the US where they hadn't really brought them under control. But we've seen other examples too. Denmark's another good example where they brought the case numbers down to a level. They then started easing as they kept growing the number of people who were fully vaccinated, and they've managed to hold their cases quite steady. They're comfortable with that because it's not associated with a high or an unmanageable degree of hospitalisation or death. So they've eased out and just now are opening up the final step now, opening up completely. So if you do it in a very careful, staged, monitored way, which is actually what's in the Australia plan, then it does allow you to not aim for COVID zero, but get the numbers down to a level you can live with, and then make sure you keep that control as you open up. Italy's the same too, actually. They've done a similar story after having a lot of trouble early in the pandemic. They've actually also managed to ease their way out of restrictions consistently as they grew their vaccination coverage, and have done that quite successfully.
What do we need to do with booster shots? Will we need to try and get booster shots to at least the elderly and vulnerable before next winter?
Well, the ones that have had Pfizer, that might be the case. So we know that Pfizer was our only vaccine in the early days, and we're still waiting to try and get AstraZeneca into the country before we made it ourselves. And so there will be some who may be like those overseas where they've indicated if they didn't have a strong immune response in the first place, they were the first people vaccinated, they'd be the ones you'd look at to see whether they need that 3rd dose. It's not yet clear whether people in younger age groups who mounted a full response will actually need a 3rd dose for Pfizer. And AstraZeneca's looking pretty good. That's not waning in the same degree. Not that Pfizer's waning greatly, but it's actually making those two a bit more consistent when you look at them a few months out from the vaccination timing. So at this stage, there isn't necessarily a plan to give everybody a booster shot, but we're still learning. So the longer it is after those first vaccines rolled out overseas, that gives us the lead time then to know what our booster doses might need to look like if needed, particularly, as I said, for those who were first vaccinated, and particularly the older people who might not have kept the immune response that they started with.
Now, we're about to talk about state borders in Australia, and you've got a couple of states here basically saying they just don't want to ever let the Delta strain in. Obviously, it's going to come in at some stage. Now, the higher their vaccination rates before that happens, the better for them. But how do they strike that balance? I mean, how long can you try and keep COVID zero going?
Oh, I think it's incredibly hard with the Delta variant, and that's what every country's learned, including New Zealand now. And so we can see a time where hopefully the ability to control the virus in the eastern states, where the virus is now in the community, and that's the ACT included now, are going to actually, I think, reassure the other states. They'll understand how it works. They'll see that you can manage it in a different way than even 2 months ago or 3 months ago in Sydney, when these virus came into the community at a time where we didn't have cover, took off, and it took everything just to try and stem the growth, let alone, get to a point where we could control it. It's looking now like we're heading definitely into a plateau period, unless, the settings in the background change dramatically. This does look like the first real signs that vaccination rate's adding a level of control. And if we can start to bring the numbers down, level it out in Victoria and the ACT as well, then I think that's really important for all states to look at, because it will help them understand, reassure them that actually if you can get your vaccination levels up, you can then manage outbreaks, particularly small outbreaks, so they don't take off. If we can bring these big outbreaks back under control, you can manage small outbreaks, and that should make easing of internal borders in the first instance, I think, that bit easier for those states.
Thanks very much, Catherine. Appreciate your input as ever. Catherine Bennett there, talking about reassuring some of those premiers. I don't know whether Stephen Marshall or Mark McGowan are ever going to be reassured. I can see those guys getting telegrams from the Queen, probably be king by then, and still shouting at the clouds about COVID.